Hi, Glenys.
Hey, Aaron. What do you want to talk about today?
How much I hate diets.
Yeah, diets suck.
So what do you do instead of a diet?
Intuitive eating. Health at every size.
So how many times have you had to explain intuitive eating and health at every size to someone?
Like 5,000 times. But that was just to my doctor.
Okay, so how many times have you explained it to someone and then they said, but diets are the only thing I know?
That's like every time. Can we pursue health without thinking about weight?
Yes, we can pursue health without thinking about weight.
That's pretty revolutionary, what you just said. But what if you just don't like yourself at the size that you're at?
I think we need to understand why, instead of just saying I need to change.
So, what's the deal with body positivity?
Oh man, that's a long answer. I'm Aaron Flores.
And I'm Glenys Oyston. And we are Dietitians Unplugged. Welcome back to the podcast. Aaron, how is it going?
Life is good, Glenys. Things are going really well. It's awesome to be back recording with you again.
Yeah, and I am so excited to have our guest on today to talk about something that I've been wanting to talk about, but, you know, I think we were just looking for the right person to talk to about this. We're going to talk to Lisa DuBreuil, and we're going to be talking about bariatric surgery.
Yeah. And, you know, this is, Lisa is someone that, you know, we each have known for some time through the Health at Every Size community, someone that I'm always happy to sort of connect with at conferences. She's the brave one who always asks really great questions during the conference and is always a great sounding board. I think she has a wealth of knowledge, especially in regards to this area. And I think it will be really useful for a lot of our listeners to really hear what she has to say on this topic.
And I want to throw, I guess, kind of a disclaimer out there because I wonder if people are listening to this thinking, are they promoting bariatric surgery? And I just want to say up front, I'm not a huge fan of bariatric surgery, but we talk about this a little bit during the show. We're not here to bring our agenda to people's decision making.
Right. Yeah, you know, we can talk about this topic and really come at it from, you know, supporting our clients in making the best decision for themselves. And that sometimes means critically looking at data and analysis. And I think really the most important thing that I think Lisa brought up is how do we incorporate the discussion around weight stigma and weight bias and fat phobia in this as we talk about weight loss surgery. So I think it's going to be a great conversation for a lot of folks. So let's go ahead and read Lisa's bio. Lisa DuBreuil is a mom, wife, fat activist, and clinical social worker. Since 2003, she has been a psychotherapist doing individual and group work in an outpatient hospital-based clinic, treating people with co-occurring substance use disorders and eating disorders, and more recently people with new-onset substance use disorder and compulsions following weight loss surgery. She also has a private practice in Salem, Massachusetts, where she treats people diagnosed with binge eating disorder and people dealing with various problems following weight loss surgery. Lisa helps people live peacefully in their bodies by improving self-care skills and teaching how to navigate our challenging body culture. But before we get to that and the episode, I just want to plug my Men's Body Trust group, which is starting on September 17th. So there's still some time to register for that. And you can go to my website to do that. We'll have some links in the show notes, but my website is bvmrd.com. Or you can go there by typing in smashtheweightriarchy.com as well. So either one of those will get you to the place to register. So if you're interested, just go to the website and check out that for more information, or you can always email me too. Glenys, anything you want to sort of highlight before we get started?
I am, you know, as always, seeing clients and having a great time with that. And I'm really starting to focus more on binge eating disorder, overeating, emotional eating, all of those sort of things. I'm finding that my practice is gravitating towards that. So if you're somebody who's sort of struggling with any of those issues, I'm really that's where I'm really focusing these days, and I'm really loving the work and loving the people that I work with. So I feel very lucky. My website is daretonotdiet.com, or you can just Google my name. I'm pretty easy to find. So yeah, but that's about it.
Awesome.
Just chugging along.
Great. Okay, so without further ado, then let's dive into our interview with Lisa DuBreuil. Well, we are really excited. Lisa DuBreuil, thanks for coming on our show today.
Oh, you're welcome. I'm really excited too.
Yeah, it's always nice when we have folks that we've met in person and we followed and just respect their work so much. So it's really nice to make time and talk to you.
Oh, I feel the same way. I feel the same way about the both of you.
So let's just sort of start off. I think one of my favorite questions is to sort of get people's perspective or stories about how they came to this work. So what's your HAES origin story, and how did you come to this, and who mentored you through this process?
I think I'm gonna say it was about 20 years ago. I had pretty much recovered from my own eating disorder. I was at that place where you start to. I rejected dieting and physical activity and paying attention to nutrition, because all of that was part of my eating disorder. And I was getting to that place, as most people do in their recovery, when you're trying to figure out, like, okay, I want to pay more attention. I'm noticing different foods impact me different ways. I want to get more physical again. And I was really struggling to find a way to do that wasn't reinforcing old diet culture stuff, and I was really kind of a bit at sea, and I was starting to do eating disorder work and learning, getting more clinical training. And I went to the MEDA conference, the Multi-Service Eating Disorder Association's conference, and a woman named Deb Lemire did a beautiful theater piece about being a larger bodied person, and it was just amazing and really stopped me in my tracks. And I looked her up in the program, and she belonged to this organization I'd never heard of called the Association for Size, Diversity, and Health, which was a brand new organization. And she followed something called the Health at Every Size approach. And I think of Deb Lemire as my HAES godmother.
I love that.
She was sort of my introduction, and so I said, I have to learn more about this. I joined ASDA, and turned out I don't know if she was the president at that time, but she eventually, Deb was president of ASDA for a little while, and that was sort of my introduction. In very early days, when I the people I've learned from besides Deb Lemire, and I also want to give credit to Beth Mayer, was the director of MEDA for many, many, many years until very recently. She for promoting health at every size at that time was very unknown. So that's how I found health at every size. And then, meeting people like Janelle Menzinger, and at my first ASDA conference, and learning from her and getting a chance to see some of the research, and Lily O'Hara, I met her there as well. It was just a wonderful introduction. And then I've also been able to learn a lot from Deb Burgard, who's one of the founders of the Health at Every Size approach. So as Health at Every Size has gotten more popular and more available information, and I on social media, and I finally got myself on Facebook, we've all been able to learn so much from one another. It's just been an amazing community.
Yeah. It's interesting how, I'm very intrigued about how Boston and New England has been such a haven for this movement, and how many strong folks are in that region practicing from this paradigm. And I love how that's this really the strong East Coast pocket of where so many of these thinkers are, including yourself.
it's been really amazing watching it grow, because when I first started out, I felt very, very alone. But I feel like every other week I'm finding out about someone else around here who is HAES oriented or really eager to learn. So it's been wonderful watching it happen.
So, Lisa, can you tell us a little bit about how you work with people who have had bariatric surgery within the HAES framework?
Sure. So I first started working, I work at Mass General Hospital in psychiatry, and the clinic that I work at sees a lot of people with substance use issues. And about a decade ago or so, we started seeing more people arriving for assistance who had had some form of weight loss surgery and had subsequently developed a substance abuse problem. And these were folks that previously had not had an issue with substances. So, of course, I was very curious and concerned about this and what was happening for people. So that is sort of how I started to do that work. And really, over time, trying to figure out how to be helpful to people who'd gone through this really major change in their life. And there's a couple of things that I always like to say right up front when I talk about working with people who've had some kind of bariatric surgery. One thing is, I think it's very important to acknowledge that I don't presume to know everybody's story about what's happened since they've had weight loss surgery. People have come up to me or in conversation have said, I had the Roux-en-Y and it's gone really well for me. And I'm not here to say that can't be true or those people don't exist or anything like that. I think it's really, really important to listen and pay attention to what people tell us and believe them about their lived experience. And the other thing is, I think there's a little bit of a, I don't know if it's misunderstanding about health at every size and weight loss surgery, because it's really important for people to know, like, I don't blame people or judge people who've chosen to have weight loss surgery. We live in a really fat phobic culture, and everyone, I think, is doing the best they can to figure out how to survive in this culture if you're in a larger body. And, I have a lot of criticisms of how these surgeries happen and how people are prepared for them and what kind of care people get around them. But it's not my place to judge people's decision making, about how to best take care of themselves and keep themselves safe in this world. Does that make sense?
Yeah, it does. And, I'm sure, Erin, you probably have clients who ask you about bariatric surgery too. And my answer is always like, I can't tell you what to do. So I just want to help you, provide you with information that I know of and that so that you can, make the decision that works best for you. So, which is part of why we want to do this podcast, right? So, because we need information. So that makes a lot of sense.
Yeah.
Yeah. And I think the other part that I would add too is adding on to what you said, Glenys, is this idea of like giving people informed consent. Like, let's look at all of the pros and cons. What is your lived experience? And just as long as you're, I think, looking at it from this angle, right, and really being aware, you get to make the choice about your body, and that's your choice, and not our choice at all.
Right. Yes, and I think especially for me as a white person who has a lot of privilege, my job does not require me to be a certain body size. I have lots of resources available to me. The pressures are different on different people to try and conform to what our culture's expectations are. And so I think especially for those of us with a lot of privilege, it's important to be very careful about being judgy about how other people maybe with less privilege are trying to manage things.
Right.
Absolutely.
Yeah.
So, how I work with people sort of depends on where they are, because sometimes I'm working with people who are considering the surgery or have decided to get the surgery. And sometimes I'm working with people who've had the surgery, and are trying to figure out how to take care of themselves. So, when what I tell people, I'm always very clear up front that I don't recommend these surgeries. I don't think they're good ideas. And I can say that, and I can be very honest about that. And I can at the same time say, but if you're looking to learn how to take care of yourself better, or if you have an eating disorder and you want to get that, you want to get more into a place of recovery before you do the surgery, or you want to learn how to prioritize your self-care, like, I can do those things. Those are going to be those are things that are going to be beneficial to people no matter what they do, whether they get surgery or not. And I also work on, like, as you said, Erin, on sort of trying to help make sure people are as informed as they can be, and they have realistic expectations for, what is actually going to happen, and that they're in a place so that if things don't go the way they think they're going to go, they're not going to blame themselves. They're going to have a perspective that will allow them to be as successful as they can be, given the limits of the surgery.
So, I mean, I think that fits into like this idea of like the decision that people, in your experience, the decision that people make either in the past or after working with you, or while they're working with you to have this surgery, is really like can be influenced by a lot of things. And if you were to sort of think about like, if it's okay, I'm going to sort of take it through 3 steps, right? Mm-hmm. The people that have already had the surgery, and even people who are contemplating it in the future, I guess that's 2 steps. Like, what do you wish that they knew about, or like what was a part of that decision before they decided to have bariatric surgery?
So I think one of the most important things, there's not a ton of literature on this, but there is some literature that shows that fat people who decide to have weight loss surgery tend to have the highest levels of internalized weight bias of all the fat folk out there, compared to fat people who choose to diet, compared to fat people who choose to accept the body that they're in. So that's like something I really try and remember. And the biggest thing that I wish people understood, and this is supported by the literature, and it's also my experience working with people, is that weight loss surgery, or even weight loss of any kind, does not fix internalized weight bias. I think that's the belief. And I think our culture is constantly telling people that if you lose weight, you'll feel better. If you lose weight, your life will go better. If you lose weight, you'll be successful. If you lose weight, fill in the blank. And the reality is people don't feel better about their bodies in general. Again, can't speak for everyone, but what the literature shows is that that internalized feeling that my body's not okay doesn't get shifted by weight loss. And sometimes people's body image is worse after weight loss surgery because of, skin issues, excess skin or changes in body shape. So that is the biggest piece that I really am concerned that many people are having these surgeries in an attempt to try and heal how bad they feel about their bodies, and that surgery doesn't fix that. And
how many people are really doing that work to look at weight stigma and internalized fat phobia, either before or after? It's, if we're sort of generalize out to the whole population, it's a very small group of people who are trying to have that conversation.
Right. And when you're feeling that burden by weight stigma, you're not in the best cognitive place from which to make a decision that's going to alter the course of the rest of your life, because that's what these surgeries do, for better or worse. You are permanently disabling part of your body's, ability to absorb nutrients and energy. And, when people are feeling really burdened and stigmatized and they're really trying hard to escape the stigma, I don't know that that's really the ideal place from which to be trying to make these decisions. Yeah. So one of the things I really try and do is see if I can help people understand that a little better and give them time to sort of think through some of the, and absorb some of the information, some of the things we know about life after weight loss surgery, so that they can think through things. And again, if they're going to have the surgery, have a realistic picture of what life after surgery might look like.
And earlier you had mentioned too that you sort of had some criticisms around the way people were prepared for these surgeries.
Mm-hmm.
Are there some other things that you wish, like doctors or primary care providers were doing to prepare?
Oh yeah, I mean,
before?
Yes, I mean, the weight stigma piece is one thing, but there's so much. I mean, one of the things I just was working, co-authoring a paper on the risks of suicidality and weight loss surgery. And we know that people who've had any kind of or many different kinds of surgeries around your gastrointestinal system have higher rates of depression and higher rates of suicidality. And they're not 100% sure about why that is. It looks like perhaps there's some changes in neuropeptide function and some other biochemical change that increases the risk of depression and suicidality. There are changes in how medications work. Many meds that we take for all sorts of things assume that we have an intact digestive tract, and so the medication is created to work in a certain way. And when people's digestive tract has been altered, the med might not be absorbed the same way. It might not be as effective. And same thing for supplements. A lot of nutritional supplements are not formulated for bariatric patients. And so now there's this whole industry of post-weight loss surgery bariatric supplements, and they can be really expensive. I mean, that's another piece is, sometimes folks have to spend a significant amount of extra money just to kind of keep their numbers up where they're supposed to be. A lot of the complications that occur with these surgeries can happen years out after, due to chronic malnutrition or malnourishment. And those things aren't going to show up in research that just follows people after surgery for a couple of years.
Right. That's always the problem, right? Like let's look at the long term, right? With weight loss, with weight loss studies, it's like, 2 years, everything's good. It's like, no, let's look at what happened 10 years down the road. Mm-hmm. And that's a big problem with all the research around this.
Right. Yeah. I mean, I would literally, there'd be a study that would be entitled, long-term follow-up on blah, blah, blah after the Roux-en-Y. And their idea of long-term was 24 months, and I'm thinking, 10 years. So you really do have to, really dig a little bit in. And there's a meta-analysis that's about, I think it was from 2015 or 2014 in JAMA Surgery, and they looked at bariatric literature going back to World War II. And they just tried to compile as much as they could. And one of the things that they found was there were many, many studies they couldn't even include because they were so poor, that they were so poorly done. There was such high dropout rates. 97% of the studies didn't go past a couple of years. It's all over the place. We just don't know that much about what folks look like 10 years out, 15 years out, 20 years out. And when people are getting these surgeries in their 20s, 30s, 40s, 50s, they're going to be living in these bodies for decades, hopefully. And so it worries me that we just don't have that much information about what it looks like after 10 or 15 or 20 years.
I sort of question, one, is part of it because, so many of these surgeries are in some sense new, right? That we're, it's hard to get that data. But I also would then question, how much of the weight bias is in the research to say, well, we've done this surgery to fix their weight. We must have solved all the problems. There's no need to follow up, right? There's like, why would we do such extensive research if we fixed everything already?
Yeah, I think that's an excellent point, that, most of the research is focused on weight loss, and the surgery is seen as a success if there has been weight loss. And I've certainly worked with people whose lives have, been really devastated by the consequences of their weight loss surgery, because of different psychosocial factors, and their quality of life is gone down significantly. But as far as their surgeon is concerned, their operation is still in his success column because they lost a certain amount of weight and kept it off for a certain amount of time. So even though they may have lost their job or developed, different mental health diagnoses or an eating disorder, they're still considered a success from the surgical point of view.
Oy.
So
Right.
So that's important to, when the literature shows, well, these surgeries are seen as these surgeries are successful. It's really important to ask, well, what do you mean by successful? The other thing too is, and this is again really important for people to know, is the surgeon's idea or your medical provider's idea or the insurance company's idea of a quote unquote problem that might require a takedown of the surgery or a revision of the surgery might not be your idea of a problem. Because that's the other thing that can happen is people sometimes develop issues and they want the surgery revised or taken down or changed, or they want some kind of assistance. And from the medical point of view or the insurance point of view, their problem, whatever it is, doesn't meet the threshold for the insurance company paying for whatever it is that the person needs fixed. Does that make sense? So that's another thing, is you could be stuck, miserable and wishing for things to change. But unless you've got the $22,000, your insurance company doesn't feel like it needs to pay for it.
Okay, that's a big problem.
Stated simply, yes. Yeah.
Yes.
Wow. Yeah, I'd never heard about that aspect of it. And again, I think it just goes to the fact that we just think about the beginning and not what these folks are going to live with during and after the surgery. So thank you for sharing that.
Right, exactly. Yeah, I mean, it's really important to understand if you've lost weight and now you're having problems with, I don't know, some kind of absorption of some micronutrient, sometimes from the surgical point of view, their attitude is, yeah, but the surgery is working the way it's supposed to. So this is not a problem we can help you with. Yeah. So it's really, and this stuff is, as you can see, talking about this, this stuff's really complicated and it's layered. And one of my concerns is oftentimes folks go to a 1-day or maybe 2-day orientation, and in 4 hours they're given a ton of information, and they might meet someone who is 9 months out of surgery or a year out of surgery, and that's a lot to take in.
Yeah.
And so I know up in Canada, someone was telling me that people go to meetings over several weeks, and so they have time to kind of absorb and digest and contemplate the information that they're given. And so a significant number of people, and much more, I guess, more people in Canada will start the process and change their mind than will do so in the United States.
I think that's That's the difference between, I mean, it's not a money-making industry in Canada, the medical industry.
Yeah.
I would assume that wouldn't be the difference.
Yes. And so people have time to think it over and maybe realize like, okay, this isn't for me right now, or this isn't going to work for me ever. And I think part of that is because they have a chance to really think it through.
Oh, Canada.
Yeah, I know. Just add to the list of all the ways that Canada is doing a better job.
Yeah.
The whole other podcast, but well, I mean, Lisa, I don't know if you know, I'm from Canada originally.
Oh, I did not know that.
So one of the reasons probably that people have to wait a long time is that often for surgeries that aren't emergency or, absolutely necessary to save your life immediately, you are just going to wait a long time to get them. So they got a lot of time to sort of educate you. And I think the Canadian medical industry, and we'll call it an industry, but, for whatever we want to call it, it's sort of not like they're pushing people through surgery. Like, you got to get this. And, it's a whole different thing. It's a whole different approach to healthcare. So, and I think that more time with some things to think about is a really good thing.
Yes.
Yeah.
So one of the things I'm coming up against in my practice is my binge eating disorder clients who are in larger bodies have doctors who are kind of recommending weight loss surgery to them, bariatric surgery for weight loss. Not really. I mean, I think they think that's going to help them with the recovery, but really we know it's just about weight loss, right? To put that person in a smaller body. What do you think is problematic with that approach, or if anything?
Do we have a couple of
I thought I'd be open. I thought I'd leave it open.
I mean, where to start? I really think of both substance use behaviors and eating disorder behaviors are coping strategies. That's sort of how I think about them. And people are doing the best they can to try and help themselves manage things that feel really unmanageable. And it's important, in my opinion, to honor that people are doing the best they can, while at the same time saying, okay, but I want to learn better ways of handling this. So we can do that. We can say, hey, you're doing the best you can here, but yeah, let's figure out some new ways of handling things. And to me, using a surgery to get people to stop binge eating is like taking away someone's coping strategy very quickly and suddenly without giving them any other way to manage things. So I think it sets people up to fail. I think it's really dangerous. I think that we understand that what fuels binge eating, amongst other things, is restriction. And that's what these surgeries create. They're surgically induced dieting, and so you're basically setting people up to continue to binge or find other ways to cope. And that's why some people end up developing substance use disorders, in part because I think it's a way that they're able to feel different and escape what's making them uncomfortable or unhappy.
Yeah. And my understanding too, with what alcohol and other substances might be absorbed really differently or much more quickly.
Yes, exactly.
After weight loss surgery, which is maybe part of the problem of why people are developing substance use disorders.
Yes. Thank you for bringing that up, because yes, that's the other piece, is that exactly with when people have had the Roux-en-Y surgery, for example, almost none of the alcohol is metabolized before it hits your bloodstream. And in an unaltered digestive tract, you're going to lose half the alcohol before it hits your bloodstream. And then from your bloodstream, it hits your brain. So people are getting twice, their brains and their livers are being exposed to twice the amount of alcohol than they would have gotten prior to the surgery. And so that makes alcohol, and it's a quicker hit. So that makes alcohol more addictive, and it causes more of a sharp intoxication, which is really problematic as well. So it ends up being like a couple of cocktails can turn into, as far as physiologically, can be like a binge on alcohol for people who have had these surgeries. And that's another thing that people need to know. And I don't think it's made clearer now than it used to be. But I think people need to understand that this effect that will not go away with time. It's not something that you can adjust to. Your body will always process alcohol differently. And it means that people have to be really careful for the rest of their lives.
Yeah.
Obviously, what we're sort of looking at here is the complexity of how, this decision to have surgery is sort of being very quickly forced on a lot of people. They're not really given as much time to process it after there's a lot of things that are coming up for them in both physical and emotional things that are happening to their lived experience. So given how you've practiced from a HAES perspective, how does this approach, how can this be helpful to the folks either pre, during, or post surgery? Because I think it's a unique perspective that folks can really embrace no matter where they are in that process.
The way that I think about it, because I don't know if you all remember, but for a long time, HAES experts, we really didn't know what to do to be helpful to people who had the surgeries, and we've had to work hard to, as these surgeries have gotten more popular, we've had to really work hard to figure out how can we be helpful. And I think one of the things that's been the most poignant part of that for me has been realizing how much distress folks are in diet culture, and that they felt like they needed the surgery, or people. The other thing is, I've certainly had people say, like, I wouldn't be opting for this surgery, except, I can't get my knee worked on. They won't do this other surgery until I do this surgery. And so one of the really wonderful things about the Health at Every Size approach is that we are really good at working with people wherever they're at, and whatever kind of health situation they've got going on. And whatever size body they happen to be in, right?
Yeah.
Mm-hmm.
Yeah. So what I tell people is, however whatever body you come in my office with is the body we're going to work with.
Yeah.
However you got to this place where your body works in this certain way, or certain parts of your body don't work, or they don't work the way you want them to work, or, whatever's going on. Like, we're really good at saying, okay, here's the body you have, and we're going to figure out how to best take care of this body that you have. Not the body you used to have, not the body you wish you have, but the body you have right now. And so no matter, this applies for people who've had weight loss surgery. It applies for people who have, injuries. It applies for people who whose bodies are not presenting their gender the way they want them to. People can have goals around their bodies, and at the same time, they're living in a body that's not working for them, or that needs special care. And I feel like that's one of the strengths of the Health at Every Size approach is we don't get all caught up in the shoulds. Well, your body should be doing this and it should be doing that. And, it's like, well, this is the body you have. And, I have a long remote at this point, but I have a long history of dieting, and, that caused issues and changes in my body. And so, I hurt myself hiking. And so I have a knee now that, I've got some arthritis, and this is the body I have. So, I work. So that's kind of the way I think about it. The body that's in the room.
And I can imagine what it's like for someone, again, no matter where they are on that bariatric surgery or weight loss surgery, if they've had it or have not, how both it could be very freeing, but also so challenging to them to be able to sit with the idea of, wait, you want me to actually like be present with the body that I have, even though I've worked really hard either to change it or I'm thinking about changing it. It must be incredibly radical for them to try and embrace some of that.
Yeah, I think so. I think there's grief and loss involved. I think a lot of times there's, there's people have lots of regrets. They have feel like they've lost out or they've made mistakes. They've done things to themselves or their bodies, or they're, they really want to believe that if they have this surgery or if they eat in this certain way, then their body will change in this certain way. And I'm often trying to give them this different perspective and trying to give them information about, well, here's what we know about what happens for most people after the surgery. And it's really hard. It can be really hard to have to listen to how you might want that, but we don't know for sure that that's going to happen. And, and it can feel, at least sometimes I feel like I'm doing a little bit of dream crushing. When I explain about how that might not be how it happens, or, you might not feel that differently about your body. And so, yes, it can be very, very intense work for people.
Yeah. It must bring up so many different emotions on many different levels.
Mm-hmm.
Have you seen people sort of kind of embrace HAES after weight loss surgery and find some relief, or what's been your experience with that?
Yes, I have. I've definitely seen people realize that this works really well for them. One of the things I try and talk to people about, either whether they've had the surgery yet or not, is, taking care of yourself, taking care of your physical self after weight loss surgery is a little bit of a part-time job, especially in the beginning. The way I describe it to people is that your margin for error is narrower than most other people's, because, I can skip meals. I can forget to drink water, for most of the day. And then I can say, oh my God, I'm starving or I'm super thirsty, and I can eat a large amount of food to catch up, or I can have a lot of fluid to catch up. And once you've had one of these surgeries, that's not always an option. So people, I can, not pay attention to my vitamin D level and then absorb a large amount of vitamin D, and someone else in with an altered digestive tract, that's going to be harder. I've had people tell me that one day they eat a hard-boiled egg and they're fine, and the next day after one of these surgeries, they'll eat a hard-boiled egg and it will really cause distress. And so it can be just harder on a daily basis to take care of yourself. And so, that's another thing that's important for people to understand, and giving yourself permission to take care of yourself that way and to prioritize your self-care. That's a skill piece. And especially, like you mentioned before, when people have had binge eating, people who have an active eating disorder or binge eating disorder, tend not to be really awesome at paying attention ongoing, and so, that's a skill, learning how day to day to be paying attention and being compassionate and kind with yourself and your body as you're trying to figure out how to take good care of yourself.
Right. And it sounds like learning what your new body cues are, because they're quite different from, what maybe they've had before.
Right, exactly. And that, that's another thing that has been very interesting for me as an eating disorder clinician, because working, I tend to try and help people build more interoceptive awareness, of their hunger cues, their fullness cues, being able to trust their body, that your body will tell you when it's hungry. Your body will tell you, it will look for certain foods, and, it's okay to trust your body. And for lots of people after the surgery, they've lost a lot of those cues. And, for example, someone's first cue that their body might need nutrition is that they're starting to get dizzy. And I know you both know that typically you get a lot of other signals before your body starts feeling dizzy to tell you that you need food. But sometimes after these surgeries, some of those earlier signals are lost. So by the time you're catching signals, it's been hours and hours. So, sometimes after weight loss surgery, people do have to rely on the clock. They do have to eat in a sort of more regimented way. Then we would typically, those of us who support more intuitive style eating are used to. So it's a little bit the opposite, because for a lot of people, I'm saying, don't watch the clock so much, trust your body more. But after these surgeries, sometimes you have to have a little bit more of a external system to support you getting in enough nutrition.
It's really like a process to relearn your body at that point, right? I mean, it's like, and it takes time to do that.
Yes, absolutely. And having compassion for yourself around the fact that, hey, yesterday this food worked for me. Today, this food is not working for me. And not taking that out on your body or being mad at yourself about that. It's a skill piece.
Yeah.
And really understanding that. And that's why I tell people it's a little bit like a part-time job. You have to expect you're going to need to pay more attention and certain, and same thing with following up with your appointments, making sure you're getting your lab work done. Every year they learn more about what folks need for long-term care support of their body. And I've worked with some people that haven't seen a bariatric specialist in like 5 years. And the recommendations are different now than they were 5 years ago. But if you're not going to your appointments, then you're not going to know that.
So much for people to consider, for sure.
Yeah.
It's interesting hearing you talk about this because it's a lot of work. Right. It's like you said, it's a part-time job. And I think sometimes the way it's presented, at least I feel like in the place that I work, it's sort of like, oh, this is just the fix. And I think it's presented not as an easy fix. Maybe that's not the right way to say it, but like, this is just going to fix it and then move on with your life. But the reality is it's going to be a lot of work of managing it after.
It's similar to what people, I do some work with folks getting ready for organ transplants, as part of my work at Mass General. And it reminds me a lot of what happens when folks get the gift of a new organ. It's not a cure, it's a treatment. And when you get a new organ, if you're lucky, you will have to spend the rest of your life seeing doctors more frequently, taking medications, dealing with the side effects of those medications, following the rules. And you can't ever forget that you've got this organ that wasn't yours originally and that needs some special attention. And having one of these surgeries, I feel like is very similar to that. You certainly do get better at it over time. And I'm not saying that like you have to spend the rest of your life, paying intense attention. People do learn a little bit about how things work, and they learn what works for their body and what doesn't. Although there's still some unpredictability, but I don't know anyone who gets to the place where it's like, oh, I never have to follow up with the bariatric people. People do that. They do choose not to follow up, but in my opinion, they're risking getting to a place where they're at risk of permanent neurological problems or other issues because their nutrition intake isn't where it should be. The other way that the health at every size approach is, in my experience, has been really helpful for people, is understanding that weight regain after these surgeries is not uncommon. It's very common, and it's part of the way our bodies try and protect themselves. And it's not a sign that you're a failure. You know, in the same way that we talk to people about how regaining weight after dieting is not an indication that you're a failure, the same thing is true with these surgeries. And I had this experience over and over again where I'm sitting with someone who has had one of these surgeries and who has regained a significant amount of weight and feels like a complete failure and believes that they are the rare exception and that they've somehow messed this up again. And when I actually explain to them that that's not true, and that it's not uncommon at all, they're always so surprised, because people assume that they're the failure. And they're the exception. And when I explain that, no, the exception is the person who's lost 100 pounds and kept it off for 5 years, they're really, really surprised. So people have described it to me as being such a relief, to know that, okay, this doesn't mean I've messed up. I can still learn how to take good care of myself. I can learn how to accept my body as it is. Health at every size can be helpful to everybody.
Yeah, I agree.
I totally agree as well. And I think that's a great place to sort of, end that conversation, because I think what we're talking about is this way of looking at food and your body. It can be applied in many different situations, including weight loss surgery. And it can be very helpful. So thank you so much for coming on the show and sharing all of this really helpful information. I learned a lot today, and I'm sure our listeners are going to get a lot of it also. Where can people learn more about what you do, and even follow you on social media to hear some of the things you're talking about? Where can people find you?
Well, let's see. I do have a website that's constantly under construction, but it is there. It's LisaDuBreuil.com. And I'm on Twitter at Lisa J. DuBreuil, and that's also my Instagram handle.
Awesome. I'm going to plug your Twitter account, because I think you do a great job on Twitter, not just of posting stuff, but also going onto threads and educating people and having conversations around problematic statements. So definitely check out Lisa's Twitter, because I think it's
that's how I first learned about you and came to know you through Twitter.
Twitter is my milieu. I will say that Twitter is definitely my jam.
Yeah.
So thank you. I'm glad you found it interesting.
Yeah, no, totally. Well, thanks again for coming on the show, and we really appreciate your time.
Yeah, thank you so much.
It's been my pleasure. Absolutely.